What's depression? So depression is, to begin with, it's a normal reaction. We feel depressed when we experience a loss, typically in life. Yes, so when a loss of any sort, then there are conditions that are pathological that we also refer to them as commonly as depression. Yes? The formal name to them, it's major depressive disorder. Yes? So major depressive disorder depressive disorders refers to a pathological condition that is characterized by persistent depressed mood. So depression associates with changes as well, both in the brain and outside of the brain. Yeah? So depression, it's what we call a systemic illness, yes, that has symptoms in the body. The core problems we think, are in the brain, but where exactly in the brain, we don't know. There are areas in the brain that tend to be affected and have been investigated. So, for instance, there's parts of the cortex that we refer to as the anterior cingulate cortex, of the limbic system that are altered, in depression. But we don't know for sure where exactly it begins and how it begins. But typically with depression, there are changes in the serotonergic system that occur. And there are a lot of changes related to inflammation. And commonly, what are the most common symptoms? Is losing, impacting sleep. Which most commonly it's losing the capacity to sleep, but sometimes also sleeping too much. Yeah? So either, and the same thing with appetite. So it's either losing appetite or eating too much. And then, in addition, is we lack energy. So we feel tired all the time and don't have the energy to do things, and have difficulties to concentrate. Then, not only it's the presence of this sadness and lack of interest for most of the time, but also is that they are present for a period of time. Yes, depression can be episodic, which in other words, can come and then go, be treated, disappear, and then the person will become well, and then relapses later on. And it could be chronic as well. And so there's a percentage of the people who have depression that will feel depressed, will have depression for a long time. Yes? So it would change the severity over time, but they would have symptoms all the time. So we have a hard time solving problems. So people would ruminate, would think about the same problem on and on and on and on and on. Sometimes, as well, people would think about suicide. Yeah? So suicidal thoughts will be popping into their heads. And sometimes these suicidal thoughts will become more intense. Yes? Commonly, I would say that suicidal thoughts occur in most of the individuals who are depressed. But most of the times, these are suicidal thoughts where people don't think that they really want to do something, but more is that they wish they were dead. Yes? And when it becomes more severe, then often the suicidal thoughts become more important, and people actually start planning on thinking about that. So depression, major depressive disorder or clinical depression is a treatable condition. And so most of the people who have depression will treat and will get well following treatment. Typically, treatment of depression is with antidepressants, with medication, and with psychotherapy, as well as lifestyle changes. Yes, so more and more we know, for instance, that physical exercise helps with depression, also helps with anxiety. A large part of individuals who have depression are forms of depression that are easily treated with either medication or psychotherapy.